I would like to introduce
Unknown caller.
Dr. Jordan Angun Lewis. Dr. Lewis is Aleut and Sugpiaq and Sugpiaq, pronounced that wrong. He's Aleut in Sugpiaq, and his family is from Naknek Native Village in southwest Alaska and Cannon Beach, Oregon. He's the director of research for the Center for One Health Research and a research professor with the College of Indigenous Studies at the University of Alaska Fairbanks. And my apologies for mixing up pronunciations. He holds a PhD in community psychology from UAF, an MSW from Washington University in St. Louis, and a BSW from UAF, and he is a certified professional gerontologist. He's trained as a cross-cultural community psychologist and gerontologist and has worked with American Indian and Alaska Native communities to identify characteristics that enable Alaska Native elders to age successfully or age in a good way and become role models for their families and communities. Using the lessons and experiences of AIAN elders, Jordan's research develops generative-based approaches to improve the health of all generations, and he has tremendous expertise to share with us today on insights on aging in a good way from Alaska Native elders across Alaska. Welcome, Dr. Lewis.
Thank you. It's an honor to be here, and I appreciate the invitation to share the work that we've been doing in Alaska for almost 20 years. Really excited to have this chance to share the lessons of our elders. I always view my role as kind of a transmitter of their knowledge and less as a researcher telling you how I came to this information. But I also try to include a lot of photos. My committee, when I was doing my dissertation, had a committee that said your pictures speak louder than words, especially for people who've never been to Alaska. So I did recognize in the panelists, there's a few fellow Alaskans. So it's great to see some familiar names, and look forward to this conversation after this presentation. So starting off with, so initially when I started my work at UAF, I've been a gerontological social worker my entire career. Tried working with different populations in social work, and realized that, yeah, working with older adults is exactly what I wanted to do. And starting my MSW work, I noticed there was a lack of racial and ethnic minority older adults in the literature and the research, as well as a lack of their perspectives on their own experiences. This idea of successful aging became quite popular in 1997 by Rowan Kahn, and since then has really kind of set this stage for how people think about growing older. What are these benchmarks that are really important for us to consider as we grow older that are important, that let others know that we're doing it well or are more successful than others. And those models have really been really grounded in biomedical models of aging, Western models of aging, that are more focused on, this idea that people who are aging well are not losing anything. And so knew I wanted to come back to Alaska to get my PhD. I have lived all over the country since then, pursuing my career. But I wanted to really, the elders I grew up with, the elders I continue to work with, not only don't meet that definition, but they lived a life where you look forward to growing older. There's something that's special about reaching that older adulthood or eldership. And how can we learn from their experiences to provide these more diverse or holistic models of growing older, and tapping into those lessons and experiences, things they did right, things they didn't do right, to really encourage all people to start thinking about their own aging process and what they could do today to age well and become an elder. So my dissertation, as I had mentioned, successful aging was still very popular when I started in 2005. And, immersing myself in the literature, really trying to figure out, what is the scope of successful aging literature. And even in 2005, after 8 years of the literature in this field of successful aging growing very popular, still was a very few people that not only worked with racial ethnic minorities or people from rural populations, but even fewer people that would sit down with an elder and talk to them about this topic. So I really wanted to, ask this question of, well, how do Alaska Native elders understand successful aging? What does it mean to them? And really spend time getting away from this biomedical understanding of aging asking questions about, all aspects of their life, whether they're in rural or urban areas. And then because it's academia, had to develop a model of aging that since then has been morphing, I guess, changing, kind of growing as we start getting more insight on what successful aging looks like across the state. We're seeing cross-cutting themes, but we're also seeing very unique things that we'll talk about. So starting off with my dissertation in Bristol Bay, I was one of the few people back then that was doing social science research in a very fisheries mining heavy region. Started there and in true community-based participatory research fashion, gave a presentation at a conference, and the Norton Sound region said, hey, would you be interested in coming to our region? So it says 2017 for Norton Sound in Northwest Alaska, but we've been working in there since 2010. And they invited us up and we got, funding to go up there. And then it's kind of built upon each other. So I know you got invited to go to the Aleutian Pribilof Islands after that. And then right now we've just finalized and are wrapping up a grant that ends next week for the interior and Southeast Alaska. And so what we've done is over these 18 years, we've used the exact same questions, exact same research processes, and kind of adapted them as needed to be more culturally appropriate for each region, culturally sensitive, culturally safe, to really kind of figure out, one, what does successful aging mean, but making sure that the data we're collecting is really relevant and applicable and can be used by the communities that we're working with. So we didn't want to just collect data for the sake of collecting data or to do publications or get tenure, but really to bring it back to the community and say, this is what we've learned. How can we help translate this into something that's beneficial for all ages, not just older adults? And so future NSF pending, right? I guess we don't know what's going to happen, but we have 2 regions left, and Kodiak is, I guess, a 3rd region, the North Slope, the YK Delta, and Kodiak. And we won't have a statistical representation of the entire state, but we will have some representation of elders across the state of Alaska. And with that data, now we can really start looking more specifically at differences around culture, region, history, and continue to bring that data back to the communities. So as of this week, we are not collecting any more new data, but we have completed 162 qualitative interviews since 2008. Age range, as you can see, is 46 to 93. Average household about 2.5, with several elders living alone, but also, as we know, multi-generational households are very common. We also made sure that in every grant rewrite, we have funding set aside for a translator so we can make sure that the first language of the elder is not a barrier. And so in the cases where an elder requests to do it in their own language, we work with a local translator, translate the documents. They're familiar with it, whether it's the elder wants to read it or the elder can't read their native language but can understand it, that they can do the interview for us. A unique thing about this study that we've discovered is up until we started collecting data in the interior region, we had exactly 50% men and women. And as you can see now, it's kind of shifted 60-40. I think that could be due to the time of the year we were in interior Alaska. Summer in Alaska is not the best time to do data collection, but we got invited to go to the Danakanaga Elders and Youth Conference in June 2 years ago. And you can imagine June in Alaska is not the best time to be asking people to do an interview when they'd rather be outside. And you can see the diversity of our marital status. And then so for our participants, I'll just add quickly, when we go into each community, what we do is we use a nominative sample. And so we go out, we ask tribal council members and elders to give us a list of people that they nominate as an elder that they respect. And that's it. We don't want anyone, setting predetermined criteria like must be bilingual or active in their culture. And so that really enables us to work with people who are recognized by their community as an elder and not based on a biomedical model of aging or these predetermined things we think are important as researchers who've read the literature and are seeing the themes in our own data. And we'll talk about why that's important. So the next set of slides here is going to really focus on going through these different regions now and kind of giving examples of quotes from our elders to illustrate what these different themes are. of what successful aging means to them. And what we've learned through this research is they're really not giving us a definition of successful aging, but they're telling us in each of these stories is they're looking up to other people in their community who they've looked up to, whether someone who's passed already or someone who's currently in the community, who they look up to as someone who's aging well, and what kind of things they should be doing in their own life based on what they see in someone else. And so that's been kind of how we've decided that they're really giving us these ideas of or elements of eldership and what they see in other people who've been recognized as elders by their family and their community that they inspire to put into their own lives. So Bristol Bay elders, these are the four main themes of successful aging for this region. This is the start of the academic career that has gone on so long, which I never imagined. So emotional well-being, spirituality, community engagement, and physical health. All the elders in this region said, this is what's important to us. If we have these four things in our lives, it doesn't matter what else is going on. I consider myself as aging well. And if you took one of these out, though, they said if you took away my spirituality or my ability to be engaged in my family, my community, I probably wouldn't be aging as well. You probably wouldn't be here interviewing me. And so these four main components are the first model of successful aging. And so an example an elder shared with regard to what they meant by emotional well-being, they shared people that are friendly and have a cheerful outlook seem to age better, view aging as another phase and are not bothered. It's just something that happens. And this, that optimism was a really important part of aging, which again is tied to all these themes, right? Like the ability to be optimistic is tied to emotional well-being. They talk about spiritual presence and physical health. So Rowan Kahn, physical health was a major component of their definition of successful aging. And what they meant by physical health is having pretty much perfect health or optimal health. Social engagement was also important. And what we learned in this work is that elders would love to have perfect health, but it wasn't a requirement, nor was it the most important aspect of healthy aging. We interviewed people who were homebound. How'd that happen? People who were homebound, who had chronic illnesses, advanced stages of cancer, and even those individuals who, didn't know how much longer they had to live because they had these other elements in their life, considered themselves as aging well, which is a very humbling experience for us in our research team when you're realizing we could be more grateful for things we have and as we age. So this is the academic model that's kind of was published in the dissertation. It's been published a couple other places. The four gray boxes are those four main elements of healthy aging that kind of feed into this idea of what we think eldership is. And so we're toying with this idea, is eldership the same as successful aging? And as we've analyzed more of this data, we don't think so, because successful aging is still a very Western concept. And so aging in a good way, or aging like your elders, is one way to achieve eldership. And then these smaller boxes around these four major components are the sub-themes of what elders were talking about when they would talk about, for example, physical health. As you can see, that health element is the largest, most talked about, but much more holistic in its approach to physical health than what you would imagine Rowan Kahn would say physical health was important. Optimism is in there, native diet, subsistence, abstinence from drugs and alcohol, this idea of effective Western medicine. And what they meant by that is, I might not have perfect physical health, but I want a physician or a provider that is open to having conversations around traditional medicine to make sure it's interacting or doesn't interact with my Western medicine. And if I decide not to take Western medicine, they're okay with that. And as you can see through these four elements, optimism is in all of them as well. So heading up to Norton Sound, we started, as I had mentioned, use the exact same questionnaires, spent some time adapting them a little bit. Bristol Bay is more of a fishing community. Norton Sound has fishing, but not at the extent as Bristol Bay. But analyzing the data with our research team, identical themes to Bristol Bay, but this region added native way of life. It was a very important part of their identity, their sense of well-being. And so one elder shared with us, an elder spoke to me about the belief that we have, the meaning of it. So each different elder gave me some knowledge that I use in my lifetime. There are guidelines I share with others on how to be elders. And this native way of life was really important as we went back and looked at other regions. It's also talked about in different ways. But having that opportunity or that outlet to not only practice do subsistence practices, whether it's fishing or arts and crafts or eating your native foods or harvesting, but having the opportunity to pass that on to other people is also very important. And emotional well-being, again, is there. Family was there. It's also very similar to Bristol Bay's idea of community engagement. This elder shared, the more the children see us, what we are doing, or what we are teaching them through our actions or work, they're able to see what we do. And the more I do things, that's aging well. Those idea of passing on your knowledge to your children, your grandchildren. They also talked about the importance of teaching your own adult grandchildren. Sometimes that wasn't always something that was done, whether it was because of, past trauma experiences, boarding school, or just not having those opportunities. And staying active through family engagement was a way to age well. So part of our work, dissemination of the research is really important. It's one of the more, again, maybe more fun parts of the work that we do. Analyzing data is fun, but having an opportunity to be creative and think outside the box in terms of how we bring this data back to each region. This is one example. We had an elder who worked with us to come up with this quote as part of his interview. And this is a poster that we made. I think we have 1,000 of them sent out. And this quote was picked by the Elder Advisory Committee. It says, "Your life journey begins when you're a young child. And we just continue one step forward. And one day as a child, when you take your first step forward, one day when you wake up, you'll be taking your first step as an elder." And so the purpose of this region was really innovative and thought outside the box in terms, they wanted this data accessible to all people, regardless of whether you go to the senior center or you go to the post office or a tribal hall. So these posters were sent to everyone. They're in the schools. And so this is one way that if you were to read this, you would know these are the qualities or things that Native elders possess that you could integrate into your own life to make decisions and be healthy. And so we had permission to share this. And this is one way that we've and had a funder that allowed that to happen. So a few years later, we received more funding to continue this work, surprisingly, and we're lucky enough to be funded by NSF continuously since 2008 to do this work. Went out to the Aleut Pribilof Islands. Had been to Unalaska a couple times, but never been to St. George. This was a new experience. Really excited again to work with APIA, the Aleut Pribilof Islands Association. And they, through conversations with their leadership, chose these two communities because of the level of activity in Unalaska, but also because they were really interested in trying to figure out how can we support the elders who are more geographically isolated, like St. George or St. Paul. And so we were able to go out there and work with them. As you can see, identical themes. I think we got like 24 interviews completed there. Weather cooperated, which was amazing. We were in and out of there in 4 days and no delays, which was amazing. Wonderful community, but they talked about the importance of community engagement, emotional well-being, physical health, and also this native ways of life was really important. And we've been working with APIA we've been bringing this data back to them, trying to figure out, the elders in this community talked about feeling not isolated so much, but there were fewer younger people here than other communities we'd worked in. And so they wanted to find ways to bring activities to improve physical health, practice their native ways of life and emotional well-being. And so APIA now has shifted some funding and resources to the community to have a tea program that used to exist in the 80s and 90s, maybe even the early 2000s, where they could get together. Resources are provided for them to, whether they want to talk about any related topics, speak their native language, or just have time to socialize and be social together. And so that's been exciting to see that our data has led to that, and it's not just sitting there. And now we're going to Anchorage tomorrow to present to the Anchorage-based API elders that we've interviewed and helping APIA figure out how they can better support elders who are in Anchorage. So one elder shared with regard to this idea of community engagement, growing old healthy, as they said, is that I give you what I was taught when I was brought up. If we hold everything back, we won't age well. We won't be healthy. Again, this importance of having community support was across all regions, and how this community engagement was interesting because it had to go both ways. And the elders would talk about this idea that I have to make my community know that I want to share my knowledge, whether it's volunteering in the classroom, leading a class, or teaching the language or a different activity. But the community also has to reach out and let the elder know that that knowledge is wanted. So it had to go both ways and be bi-directional. And that really would lead to a much more stronger, healthy relationship between the community and their elders, as well as their family. And with regard to physical health, and elders said, as long as you're moving around, you stay young. Do things you like, and then you stay young because your mind is active. And even within this, so several of our elders, as I'd mentioned, had different health conditions, health limitations. So as long as you're doing as much as you can, that's what matters. That contributes to this stronger mindset. One elder, shared with us what she does every day is she mops her floor, and that's her level of physical activity she can do, or she'll walk to the post office one day. But mentally, to her, that's being physically active and doing as much as she can without overdoing it, and it keeps her staying young and healthy. So we don't have to run a marathon every day or lift weights if you don't need to. So part of our work, in rural Alaska, several of the elders equate urban living, Anchorage, Fairbanks, Juneau, as a very unhealthy place to live. Either it's unsafe, it's not a good place to walk. Anchorage doesn't have the best transportation system if you're an older adult and don't drive. But we also know Native elders are aging well in urban settings. And so I had a student that was getting her PhD that really wanted to focus on what does urban successful aging look like? And how is it different or similar to rural Alaska? And are there overlapping themes? And so what we did is we were able to work with Norton Sound Health Corporation. They were particularly interested in learning about their Anchorage elders who had moved from the Norton Sound region to Anchorage, and figure out what can this research show to help ease that transition, whether it's temporary or permanent. A lot of people move to Anchorage for healthcare, follow family, maybe jobs, or, it does cost a lot to live in rural Alaska. So even cost of living may be cheaper in Anchorage or Fairbanks or somewhere else. And so we were able to track and recruit elders from the Norton Sound region who live in Anchorage, Wasilla, that area, Palmer area, and asked similar questions around successful aging, but then we added some questions around migration, trying to figure out what would have led you to stay in rural areas in Norton Sound, what would have helped with your transition and your adjustment to Anchorage, and then what can continue to help you if you decide to stay or have to stay. And so what we found in this region, very similar themes again: family, community, emotional, physical well-being, spirituality. For the elders that moved permanently or moved to follow family, it was interesting. We found out that when they moved there, they were under the assumption that they would spend a lot of time with their family. They would be able to maybe improve those relationships and have a more healthy relationship. But what they found out is they're actually more alone now than they were in a rural area without family. And so this elder shared, my grandkids keep me very busy, but I like it. I don't mind doing it with them. I'm happy. At least I get to meet and be with them daily. And that's usually on the weekend. What they talked about is, during the week, their kids are in school, their own kids may be working, their grandkids are in school. Then they have their weekend activities that the elders are able to go to. But most of the time, a lot of our Anchorage elders share that they're just sitting at home unless they're able to drive or have someone that can get them to the Alaska Medical Center. Lobbies are a very popular place to hang out until you figure out where your community is. But Anchorage can be big if you're coming from a rural area. So this elder shared with regard to the community of Anchorage, they shared, no, it's scattered. Our community here in town is scattered. Here, we're all strangers, except people who are your relatives from the village or sometimes native people. And so for some of them, it took a while to find out where their community was. Did they hang out at a certain church? Did they gather certain places? There are certain little areas of Anchorage where people from a certain community start to move to. And so um, Norton Sound really wanted to figure out what can we do to help kind of not solve this problem, but help people get connected if they have to move, connecting them to resources, connecting to the people from their same region or same village to help build that community sooner. Because for several elders, again, it took them 6 to 9 months to find out where they fit. The other really interesting about Anchorage that's not on this slide is access to subsistence foods. A lot of the elders, and I'd never even thought of this, was who do you ask if you want to seek permission to harvest on the land if it's not where you are originally from? And so a lot of elders wouldn't go pick berries or go harvest subsistence foods until they figure out who the appropriate person was. And for a lot of elders, that was a challenge and took them a long time to figure out. But on the upside of that, a lot of elders talked about these access to resources was overwhelming in a good way. They would laugh about, tasting their first vegan food or going to have Chinese food or these things that were new to them, and having options on which kind of doctors to see or having access to specialized care they didn't have before. So there were positive things. And so we got invited to go to Nilchik, which is down on the Kenai Peninsula. It's a small community, very interesting. It's a melting pot of Aleut, Sugpiaq, Aleutic, and Athabascan, with a very strong, all of them speak Russian is their first language. So very unique, but also very close-knit community. The history of Ninilchik was something I didn't know. Anyone can become a member. It's not like that anymore, but up until the late 90s, anyone who moved there would become a tribal member, whether you're a native or not. And so they have a very strong tribal council. They have a lot of financial resources. They have incredible resources for their older adults. And so in this community, most elders are able to age in place because they have a gym with elder resources that provide, strength-based training, falls prevention, all these things that the tribal council is dedicating these resources to keeping elders at home for a long time. So social connection, emotional well-being, physical health, and staying busy. This idea of staying busy was really important. They talked about, mentally active, socially active, and that usually through, they have a gym, but they have a senior center. They have games every night. They take vans of people out to go pick berries, go hunting. So again, similar themes to what we're seeing in other regions, but a very different perspective on what idea of community is, and it's not just a rural area. So, and it's on the road system. That's another, I guess you can drive to Anchorage, you can drive to Kenai. So access to resources is different. It's about 4 hours from Anchorage, so it takes a while, but you do have that access. So with regard to social connections, and elders shared, don't sit there in the dark and let yourself deteriorate. Reach out to somebody, anybody, to get the help that you need for whatever you are going through. And this elder shared with regard to physical activity, you need to eat well, exercise, socialize, stay involved with all ages. And this was one of the first communities that has now since then become a very common theme that young people need to be involved in this work. They really wanted us to do a community presentation at the school on what healthy aging looks like and getting young people to start thinking about these questions, which I think is important. As we've learned in the rest of our Southeast data and interior data, is like several of the elders said, well, we're already 70, 80, 90. You should be asking people in their 20s and 30s these questions and then revisit them again in 20 years and see if they're doing anything to improve their health. So important lesson learned. So we just wrapped up Southeast Alaska. We were down there about 2 weeks ago, presenting all our data back. And all of our work, we go back to each community about 4 or 5 times over the course of 3 years. NSF grants are 3 years. To really make sure that's our way of ensuring the community feels invested and supported, engaged in our work. We do go more often if we need to, but that's kind of the average. So we just got back from disseminating research there to 5 communities, maybe 4. And this is an example of what our report looks like. We do a community report for every region, kind of does like a very thorough summary of all the major findings, a history of the project, and then at the end of it, we provide if they're interested, a comparison of how their themes differ from other regions of Alaska. And so this is just an example. We had these professionally printed They're available to anyone who's interested. And also, an important part of our work that I didn't mention at the beginning is we have an elder advisory committee for every region that we work in. And they're involved in any aspect of the research that they're interested in. We've had, more active elder advisory committees, like the Southeast is extremely active. We get emails from them at least weekly. Norton Sound, we have one for the southern subregion that's been active for a couple of years. And we present this all back. We present it first as preliminary findings to get feedback, make sure that what we're analyzing as researchers doesn't come across as just biased by what we see, but making sure it is truly reflective of the elders' experiences and the knowledge. And then that's our way of also being able to share with a wider community, again, this idea of what we're learning and why it's important for everyone to know this. So in Southeast Alaska, they had 6 components of aging well. As you can see, it's very similar to the other regions: spirituality, native ways of life, community engagement, emotional health, physical health. And they added this idea of generativity, which, as we've had conversations with our EAC, is a very Western term, Eric Erickson's work. So we've shifted to just saying intergenerational sharing, this idea that you have this knowledge and wealth of resources you've accumulated over your lifetime. And as we get older, we have this desire to pass that on to improve the life and quality of life for future generations. And so that was something that was new, that now we've gone back, we started looking at the data again in other regions to see if it also is there. They also shared different insights we didn't have other regions kind of share. Again, as I had mentioned, this is a very active region, but they talked about the benefits and challenges of aging in Southeast Alaska, and more specifically, provided examples of why elders stay or leave. And a bulk of it really focused on the weather. Is it safe? There's fall risk if it's icy, it's cold, it can be windy. A lot of them leave because of the weather. Another really interesting thing, the Alaskan Brotherhood and Sisterhood was founded in Southeast Alaska. It's a very strong presence. 2 of our EAC members founded Alaskan Brotherhood. So we had a really strong request of our EAC to get more work around advocacy and getting younger people really to think about how could they advocate for the health and well-being of older adults while they're younger. What would they want their future to look like when they become an elder, and start having those conversations now. NSF really isn't interested in funding advocacy work, but we're exploring different ways of how we can support that kind of work, because it is important to think about supporting young people. So Interior Alaska, being here in Fairbanks, they've been interested in this work as well. Danakanaga has been a partner on our work since 2005, 2006. And so from the last few years, we've been traveling throughout Interior Alaska, doing data collection, presenting some preliminary findings. All the same 6 components as Southeast Alaska. And so we were able to kind of look at see if there's any cultural differences. This region had additional findings that were almost equally as important as these 6 components of aging well, including the importance of place and location. This was another region where you saw a lot of migration of back and forth from Village to Fairbanks. It is definitely cheaper to travel within Interior Alaska than going to Norton Sound or other places like the Aleutian Islands or Southeast. And you see a lot of people going back and forth for healthcare, for family. They might have a house in Fairbanks, but they have a house in their village. And this strong dynamic community support was very apparent. And again, intergenerational sharing. So one elder shared, so as I worked and lived my life in the woods, I'm a hunter, a trapper, and a fisherman, so I'm a great advocate. I consider myself as a traditional knowledge specialist because I did all that for so long. So I'm a valuable resource to people that haven't had the chance but need the information. Very strong community, a lot of strong culture, practices, values, language preservation, young people very involved. This was also a region where we're getting more requests to have younger people have created a youth advisory committee. So our future NSF grant that we just hopefully is under review and still going through review has an intergenerational advisory committee where we have elders and youth working together to kind of guide our research. And this is an example of what our Southeast, our interior report looks like. So those are kind of like the major 6 themes of aging well. But as we've kept analyzing our data, we started noticing there's other things, or as we've continued mentoring people, we've had over 70 people involved in this project in some way. Um, Internationally, we've had people involved, postdocs, junior faculty, graduate students, undergraduate students, high school students, who've had some chance to be mentored. And they all bring very unique, different perspectives. We've had medical students really interested in this idea that if you're working with an older adult who considers themselves as aging well, did they go to the doctor? And surprisingly, they don't. And so through that knowledge, now we have several clinics who are sending once or twice a year checkups out to their elders' home to make sure they're doing what they need to be doing. Because we heard stories of elders who said, well, this medication is really not doing anything. I'm feeling fine. I'm aging well. I'm engaged in my community. I have a supportive family, so I don't need to keep taking it, whether it's hypertension medication, diabetes management, which, as we know, may not be the best thing to stop doing. So, but when you consider yourself aging well, you kind of don't feel, or sometimes you don't feel your health is at risk. And so these are other influences that I think over time we're going to start looking more specifically at in terms of how they interact or support aging well. The environment's been huge, of course. Alaska's a lot of strong connections to the land. Climate change comes up a lot. Maybe climate justice is the right term now. Humor, we've written publications on humor. People are really interested in native diet and how native diet, I'm not a dietitian, but there's people who are elders have shared with us that if they have stopped eating their native diet, their eyesight gets worse, their arthritis gets worse. So we're definitely interested in partnering with people to kind of look more specifically at that aspect. The history of elders, we have a master's student here who wants to get more experience with history research. And so across the state of Alaska, there are different historical events. And we notice in these interviews, history plays a really big role in how elders understand their aging process, but also how it's impacted them as they've grown older. And so what does that look like? And can we overlay on the map different historical events that have played a role in these regions, and kind of can we see if there's a connection to the data we're seeing? We also notice there's generational influences, younger elders versus more traditional older elders, and a few other areas. We just finished a publication and got it out on migration and relocation experiences of older adults, which was a fascinating topic. So as we think about shifting gears, all this information is wonderful, but as again, we don't want to collect data just to be collecting data, but we really want to have a practice or application. All of the data is housed in the communities that we work with. We have copies here, but they have the original data. Elders have, communities have used it to create an online database with all the recorded interviews with photos of the elders. They have all the transcripts uploaded. It's like an archive of their elders' stories. When we think about practice, the last 8 years I was teaching in a medical school setting, and really encouraging our future doctors. How do you think about not only elder health, but the role of culture in healthcare, and thinking about the person first and then the medical aspect of it, being that they're both important. When we think about healthcare providers, social science providers, who are, the variety of people that may be working with rural communities, indigenous communities, or older adults, whether they're native or not. We have, several of our efforts that have been happening over the years is, the development of translational services. That's wonderful. There's having a translator in the hospital is really great for people who need that service. Part of that is important. You need to ask what type of translation services. We've had some projects where they've translated all the research and all the health information into the native language for older adults, and then they never asked if older adults were actually educated to read their native language. They could speak it, but they never were taught how to read it. So great effort, but again, the importance of community engagement. We need to be aware of the history of Alaska Native American Indian elders, but also just communities in general. And if you're not familiar, being comfortable asking those questions and being open to sharing those stories, and having that safe space, because some of that history is not always positive. We need to understand generational differences. And this comes from my teaching at the UW School of Social Work in the gerontology classes. We're all from different generations, but when you think about younger elders who are 40, 50, 60 versus people who are 80, 90, life experiences are very different. So being aware of those generational differences, whether it's through reminiscence therapy and you're trying to find the appropriate therapy to use, or music, um, making sure you're aware of elders who are from interior Alaska playing certain music from their era may not relate. Maybe you need to go, try traditional music. This larger one has come from conversations with the WAMI region and the Alaska Medical Centers, this idea of developing culturally appropriate standards across the system. That is a much larger systems approach. I think that'll take a long time to develop, but this idea that you would put these kind of questions within a computer system, whether I can't even think of the names of them, but this idea like asking cultural protocols, spiritual preferences, for example, when an elder passes on, what's the appropriate process? Who do you contact first? In interior Alaska, it's not the family, it's the priest. So making sure you have those questions available, or the right resource to ask to make sure you don't, we all make mistakes, but having those processes can help alleviate some of the stress later, or when there's an emergency, you have those resources. We also know that offering culture-specific or culturally relevant, culturally safe activities to engage your residents, your patients, is one way to honor who they are, can celebrate their identity, but builds interactions and brings people together, also educates the staff. Part of this work, we're seeing Centers of Medicaid and Medicare Services are really being the advocates for getting more traditional foods and traditional diet into the healthcare systems. Alaska Medical Center, several of the long-term care facilities in Alaska have that work. And so including with that, having dances if that's appropriate, and providing opportunities for arts and crafts. So these come from things that I've learned over the years. Dawn Thibodeau is a social worker here in Fairbanks that I've known 20 some years. As we think about not only the work that we've done with healthy aging, but how do we encourage others to think about what Alaska Native, different cultural groups, and not just Native, but we all have different backgrounds. We all have a culture of something that's important to us. Bringing those groups to the people, don't making them always go out. So if you're in a facility or you're an organization or you're a social service agency, are there ways that dance groups can come in and practice there, or Native organizations can be there? Providing those in-service trainings to educate healthcare workers or social service workers, cultural humility, cultural diversity, communication strategies, and where are those resources? The other thing, it's interesting but also sad. I've worked with several students who, other than their grandparents, have never worked with an older adult ever. And so how do you encourage people to just break that barrier or break that fear? I guess we also live in a very youth-oriented society, but engaging elders in conversations, having those basic questions of, I had a student ask me well, I'm going to work in voluntary nursing home. What do I do? Ask who they are and where they're from, start that conversation, build that rapport. But they also want to be involved in different activities. So engaging them if it's safe to do so. They do a phenomenal, several agencies in Alaska and across Indian country do phenomenally with engaging older adults and residents in different activities and helping them determine future programming that align with what their interests are, because they're more likely to participate. And of course, if it's safe to do so, always asking permission of the older adult if they're able to respond, encouraging the family, whether it's biological family, fictive kin, or whoever they call family, in these activities if it's comfortable for the elder. We have to remember not all family members are healthy at certain times in their life, and so sometimes they may or not be welcome. So making sure that's known. So in conclusion, I think healthcare providers who work with elders, if you're able to find ways to either bring older adults or engage them in these activities, promotes this idea of healthy aging, physical, mental, spiritual, cultural health, communication and collaboration across agencies. I think this is another big systems thing, right? It's as someone who's in Alaska that you go to different clinics and don't talk to each other, so you have to repeat yourself. And elders share this all the time. I'm tired of telling my same story over. I'm just going to quit going to the doctor because they just don't listen, or I never see the same person twice. So how do we build that collaboration and share those resources? And we have this idea that, as we grow older, yes, there are losses. And despite, this adversity that several of the elders we've worked with, whether it's trauma, addiction, different things happening in their life, they teach us how to remain resilient using the resources that we have. whether it's your family, your community, your culture, your spirituality, um, and to honor that, and that we all have resiliency within us and the ability to overcome adversity and learn from their experiences. And one key to successful aging, and this is across all ages, not just Alaska Natives or all cultural groups, is the idea of being able to share your knowledge. And it's okay if elders are not ready to do that. Not everyone is generative or wants to be, but having that outlet is key to really positive mental health and teaching others of all ages from birth to 90 plus how to age well or learn from their experiences, help them heal through sharing. Um, we can learn from their experiences. They've been through hardships, they've been through really good times, so we can all learn from their experiences and figure out how their lessons apply to our own lives and see what works for us. I want to thank you for your time. My trip to Southeast Alaska also was my first time ever in a float plane, which surprisingly, growing up in Bristol Bay, that never happened. So I'm happy to answer any questions and discussion comments, but I want to thank you again for this opportunity to share the experiences of our elders.
Thank you so much for this, Jordan. This has just really been interesting. Some of you know that I was born and raised in Anchorage, and so my heart just sings when I hear about the country up there, and so many new insights. So thank you. We're collecting questions right now. I actually have a question about, and I appreciated you mentioning how somebody working with an older adult for the first time, how they might approach that. But I'm wondering about working with Alaska Native elders outside of Alaska who may come to clinical settings. What kind of approach? Because clearly they have unique cultural perspectives depending on where they grew up. And those perspectives are unique to and potentially different from other indigenous populations.
Yeah, that's a great question. So I did, when I was at UW School of Social Work, I was able to work with a few students who were working with different agencies and was able to kind of do some small pilot studies with Alaska Native elders who lived in the Seattle area. I think asking where they're from, what's their favorite thing about being from home. Um, One of the interesting things I learned in my experience, which was very surprising me, well, I guess it was surprising and not at the same time. All the major hospitals in Seattle have a contract with Alaska Medical Center. That if you're at Swedish, if you're at Virginia Mason, each hospital has a traditional foods freezer, and all of the food is free. You should get free taxi vouchers. You should get free lodging, which wasn't found until my partner was working there and had a native elder who was sleeping on the hospital floor, had no idea these resources existed. And so I think asking those basic questions, kind of figuring out, what are their preferences, what would they like, and kind of, we've written a manual on how to integrate care culture into care that we could share. It's available to anyone. Dawn and I wrote it over a couple of years, giving really concrete examples of what you can do, whether you're a social service provider, a healthcare provider, a student, someone who's wanting to learn, work with older adults or people from different backgrounds. Very simple things you can do to help ease that transition to make them feel more welcome and supported.
Excellent, thank you. Mary is mentioning, she says a bit off topic, but she left Fairbanks 55 years ago and was curious if the Pioneer Home system was still functioning. She was young then and thought it was an excellent idea that seemed to work well. I wasn't sure if Alaska Natives
Mm.
participated in the Pioneer Homes. I would love to hear that they did, but having
Yeah,
grown up in Anchorage, I know that things were not as inclusive as one would have thought they should be.
yeah, Mary, that's a great question. So the Pioneer Home system still exists. It's still functioning. It actually has a 17-year waiting list. All of them do. And it wasn't actually until 7 to 8 years ago Alaska Natives were actually considered a pioneer. So now they've opened that eligibility to Alaska Natives, which is good. I think it may be 10 years. Um, but yeah, it's doing really well. I don't know, like, I know all the other, like, there's one in Juneau, Anchorage, here. There might be
Maybe
one more.
Nome. I don't know.
yeah. So yeah, it's they're doing some they're doing good work. I've worked with them over the years trying to figure out how do we get as they've opened it up to Alaskan Natives. Maybe it's been longer than that. When I lived in Anchorage, 2016 maybe, as they really wanted to figure out how do we get culture into care now that we're working with this population. It was brand new to all of them and trying to figure out like what does that look like. So
Hmm.
yeah, it's doing well.
Juanita said one thing learned on Prince of Wales Island was that the Tlingit culture is a matriarchal society, and she often wondered why their patient was bossy with her family and her community members. After she died, I learned that she was the top elder in her community. Is that
Oh,
something that you see across Alaska Native cultures or specific to specific tribes and councils?
I know that's how the Southeast cultures are. They're matriarchal. I think some interior communities are. I don't think every Bristol Bay region's not. I don't think, but yeah, I don't think all of them are. The other thought that I had is as we grow older, there's a survey that not a rigorous, the Pew Charitable or Pew, whatever that one that USA Today does.
Yeah.
And as people get older, when you get to your 60s and 70s and 80s, you care less about what people think about who you are and what you have to say about things. It become like, like there's that joke, like, I can't wait to be an elder. I can say what I want. You're more comfortable in kind of voicing your opinion. And so my thought was she wasn't boss. She just earned her right to be an elder.
And to what extent do the Alaska Native populations participate in and benefit from the broad community health networks that have more lay people trained to provide health services out in sort of distant areas of Alaska?
Yeah, that's a
I
good.
can't remember what that system is called, but I think you probably know what I mean. And I'm just wondering to what extent the Alaska Native elders are able to benefit and participate in that.
I would say it probably varies by region and agency and what they're able to provide. I know, like in Bristol Bay, it's challenging to get like home health aides, right? Who are able to one, you have to fly to King Salmon or Dillingham and then go
Yeah.
out to the smaller villages if you like. And is it financially feasible? I know tribal health systems are doing excellent work trying to develop, grow our own, right? Like train our own people who are in the communities. Um, I would defer to some of the people online who are from rural Alaska that are probably much more familiar with what that looks like. And I just hear from more of the urban perspective of I wish we could get more people who are trained. Um, and it's for people who maybe not from rural. It's a shock to go out to somewhere like Togiak or Manicodic where it's like you're coming from Anchorage and you're here for home health and it's like your cell phone may not work and there's running water, but for a lot of people that's a big shock. I mean, I've had students who've never been off the road system, so it's still happens.
Christine, I see that your hand is up. Did you have something to share? I've just made it so that you could talk.
There we go. Okay. My
Hey.
flipped up. Yes, this is Christine Schultz. First of all, Quiana, Jordan, always wonderful to see you. And thank you for your very kind words about the Norton Sound area and our work together. So I am calling in from Norton Sound Health Corporation out in Nome, Alaska. So I was going to say a couple things. First is yes, the community health aid system, which is I think the term you're perhaps looking for,
Yes, thank
Barbara.
you.
Community health aides are alive and well, and we are one of the training centers in the state for that program. So they provide primary care in all of our villages. And if we're lucky, we have a mid-level provider with them, but frankly, they do great without them and provide excellent care. One of the other programs that Norton Sound is doing that I oversee is we are also providing in-home care. So we have personal care attendants that are just a little bit below certified nurses aid level of training that are going into the home and providing home care to elders through Medicaid waiver programs, but also we have a dementia grant with Indian Health Services that we're using some of those funds for respite care for dementia as well. So yeah, we're trying to be creative and it's so important to learn from our elders. I just became an elder couple months ago, so I'm very proud of that, and it feels great. So thank everyone for what you're doing for our elders, Koyana.
Other questions from folks? I'm wondering if people from other areas of the Northwest region, not necessarily Alaska, have connected with Indigenous elders, particularly those from Alaska, and what your experiences have been or your questions have been. And please feel free to put some information into the chat and let us know what your setting and discipline is. For example, I'm assuming that folks might not have as much experience working with Alaska Native elders outside of Alaska, and so those questions about how to approach, be respectful, address their particular perspectives would be paramount. That's part of the age healthy, what matters, I guess.
Right. I didn't add it to this presentation, but we get the similar question of, are there similar things that people talk about healthy aging with other racial ethnic minority populations, Asian Americans, African Americans, different immigrant populations? Almost, I mean, the themes are very similar. And so when you're working with other populations, some of the themes that we find in our research can kind of help maybe guide what you could ask about in terms of other populations you may interact with.
And just help everybody remember the vastness of experience and the importance of understanding all of that. Yeah. Juanita says she's an RN in home health on Prince of
Wales.
Prince of Wales Island. The elders here seem well connected, and we see a lot of them. I think your work is very important and seems spot on, I guess, to her experience.
Thank you.
What is your sense, Jordan, of the Indigenous populations in Canada relative to the elders in Alaska? Have you worked with folks who are working with Indigenous elders in Canada?
Yeah, we have collaborated a lot, more on the dementia research side. But yeah, there's been some excellent, I think some of my motivation came out of work in Canada in the early 2000s. Sean Wilson's work around Gwich'in Native elders was one of the first books I read that was like, yep, I guess you can work on strength-based perspectives of aging. Yeah, I mean, it seems like in the research world, and specifically with older adults, whether it's cultural preservation, language, treatment of our elders, Canada seems much more ahead of America in a lot of different things, and how the resources and the programs they dedicate towards supporting older adults and their ability to and their desire to be, culture bearers. And, they have elder in residence programs across most of the universities in Canada. It's like a common thing that you would see, like an Indigenous elder in the classroom, which is starting to build momentum in America, but not quite there. And Canada gets their inspiration from New Zealand, the Maori population, and the Indigenous people in Australia. So it's like I think hopefully we're getting there. I think that one of the big differences for us is that NIH is really focused on a problem-focused research project. You have to have a problem to fix, right? So it's been really hard for people like the work that we do, where it's more strength-based, like let's build upon what's going well. That's not fundable by NIH. They don't care. So my dementia caregiving work, I had to find a problem in a caregiver and build upon that to find, and then through talking to your program officer, you can add small parts of strength-based work. Whereas in Canada, the Canadian Institute of Health Research, they want to see these strengths highlighted. They want your research to really build upon the successes of what people are doing. And so I think that tells a lot about, as a country, what we prioritize first. Mm-hmm. And how we fund it. Well, who knows, NIH might not be existing very soon, but unfortunately.
Yeah, well, I just hope that we can preserve that strength-based focus because it is so important. Mary said she did a locum psychiatry on the Shoshone Reservation in Wyoming over 2 winters, but most of her clients were younger, though they were a few elders who were a joy to work with. They shared thoughts on the similarities between their elder culture and my background. She is Mohawk and Shawnee.
Yeah, that's a great point. Yeah, so I was lucky enough when I was at UAA for working in the WWAMI program, I was able to bring 2 undergraduate students from reservation in Montana. I don't know why I'm blanking, but they had never left Montana. And so we are always trained in graduate school. And when you're research, right, and I think she makes a great point that there's difference. We're all different. We are different, but there's a lot of cultural similarities. And so when we brought those 2 undergraduate students to Norton Sound, they were blown away by how similar the cultural values were within the communities. They're like, I feel like I'm at home, even though I'm thousands of miles away. Why are we always talking about us being so different when we're not? And so I think there are unique things that make us different, like cultural practices, maybe our native foods, but overall, I think there's a lot of indigenous values that overlap that bring us together that we need to remember. So yeah, appreciate that point, Mary.
Well, and it makes me think kind of interesting people who are very distant in distant rural areas and sort of living off the land and sort of subsistence living that potentially instills certain kinds of cultural values that cut across Alaska, Canada,
Right.
Montana, Wyoming, whatever, Washington State.
Yep. Yeah.
Interesting. Well, I don't see any other questions. I think we're all still really thinking about what you've talked about and all of the new sort of insights that we're gaining from the findings that you've had. Thank you, thank you, thank you for doing this work. It's been long needed. I really appreciate it. And thank you for sharing.
Yeah, thank
You
you.
know,
If you'd like me to send any publication of that resource, I'm happy to email. You could share it with whoever's
okay,
interested.
thank you.
Yeah.
So we will see all of you next week. Thanks for joining us and have a very nice evening and a great weekend. I hope the weather in Alaska is decent right now.
Fairbanks is not too bad. It was up in the upper 50s last week, and now we're back down in the 30s, but at least there's snow is melting.
Yeah.
I don't know about Nome, but yeah, we're ready for summer.
Okay, great. Thanks so much, Dr. Lewis.
Yeah, thank you.
Thanks for joining us, everyone. And to all of you in Alaska, I miss you.